Another protest taking place in Huntington. Shelby Borough reports more people came to share their concerns on the possible cuts to Medicaid following a similar rally here in Charleston that happened on Tuesday.
To vote to cut Medicaid, she is basically sentencing her constituents to death.
People came together Wednesday outside of a private event that West Virginia Representative Carol Miller was attending in hopes of catching her attention to take their concerns when voting on the House of Representatives budget. This is part of a series of similar demonstrations that several coalitions in the state came together to organize to try and urge the state's lawmakers to vote against the One Big Beautiful Bill, including a gathering on Charleston's west side on Tuesday.
Our only ask here tonight is for a meeting with Carol Miller, the woman who's supposed to represent us and who has, who basically has ignored us her entire tenure in Congress. She's not thinking about us. I mean, Southern West Virginia has one of the largest amounts of people on Medicaid than anywhere in the state.
Senate leaders are hoping to have the bill passed by July 4th, and that could see Medicaid funding cut by $700 billion and would add more requirements for coverage, including a community work requirement and requiring 2 eligibility verifications a year when it's previously just been 1.
We're all West Virginians. We all care about each other. That's our heritage, to help our neighbor. And we've got to continue to do that, regardless of what party anyone's from. A yes vote on this bill will do nothing but gut West Virginians.
West Virginia has $5.5 billion in Medicaid spending, with many relying on it, which is why some people say this cut could be life-threatening.
I'm a pediatric intensivist, so I'm here to advocate for my patients and also for my coworkers, because in West Virginia, 1 in 3 are on Medicaid, and for our children's hospital, about 50% of our payees are on Medicaid. So that means that if there are cuts to Medicaid, there's going to be cuts to our children's hospitals as well as our other medical facilities here.
According to the West Virginia Center on Budget and Policy, 166,000 people could lose their health care if these cuts happen. Medical professionals say this cut would also put a strain on hospitals statewide, causing thousands of healthcare jobs to be lost.
I know for when I take care of critically ill children, I may have to arrange to transport them several hours by ground or by air already. So if we lose any more hospitals, the risks are very real when one of our family members gets sick, that it might be harder to get them to the place that they need to go.
In Huntington, Shelby Borough, Eyewitness News.